So I'll just start again by welcoming everyone to today's session titled Youth and Environmental Health under the theme Uniting for Change. I'm super excited as a young activist to be making this presentation to you. And I'm sure at some point, our time in our lives, we didn't understand the linkages that exist between climate change and health. But I have a saying that goes, the health of our planet is also linked to the health of our people. So to get started, I'll tell you a bit about me. As you know, my name is Ashley Lashley, and now I got to the point where I'm appreciating that it rhymes. I'm a 24-year-old UNICEF youth advocate and also recently appointed CARICOM Youth Ambassador from the beautiful small island in the Caribbean, Barbados. And I also founded the Healthier Environmentally Friendly Youth Campaign. So to just take you guys a step further as to why I chose this approach to my advocacy, it actually started in 2016, where my advocacy began on non-communicable diseases. And from there, I understood that the impacts of the climate crisis was having on people's, not only their physical health, but their mental health. And this is what led me to start the Global Hey campaign. I wanted to share with you guys a video called For Every Child, There is a Healthier and Environmentally Friendly Future. And we partnered with UNICEF on this. But currently I'm having some technical challenges in showcasing the video, but in summary, it just showed an intergenerational approach with different messages from world leaders stating what more needs to be done to take climate and health action. So you guys can feel free to find this video on our YouTube channel or any of our social media platforms at the Hey campaign or Instagram at @WeAreHey. So I'll skip to the next slide. And this is where the heart of our conversation today begins. So we said that climate change and health are interconnected in several ways. The climate change patterns and environmental conditions directly and indirectly impact human health, both in the short term and long term. And here are some of the key ways that I want to share with you in which climate change and health are interconnected. So I hope you guys are super excited as I am to learn a bit more about the linkages and the interconnectedness of climate change and health. So it starts by the extreme weather events, which many of you know. Climate change leads to an increase in the frequency and intensity of extreme weather events, such as hurricanes, floods, heat waves, and droughts. I'm sure some of these activities are present within the countries in which you guys are representing today or currently living. These events can result in injuries, displacement, and loss of lives. They can also disrupt essential services, including healthcare infrastructure, leading to reduced access to medical care and increased health risks. Yesterday, I was also given a presentation and I was speaking to that there's a need for more or greater investments in climate smart technologies to ensure that our healthcare sector become more resilient to the impact of the climate crisis. Another example is that of heat-related illnesses. So rising temperatures associated with climate change poses very significant health risks, particularly for vulnerable populations such as the elderly, children, and those with pre-medical conditions. Youth are one of those key focus groupings that are considered the most vulnerable when it comes to climate change and its impacts. And they often said that we would be the ones who would be left to bear the brunt of the impact of the climate crisis. So heat waves can lead to heat exhaustion, heat stroke, and other heat-related illnesses, causing severe health complications and even death. And then we go into like vector-borne diseases. So climate change influences the distribution and behavior of diseases carrying vectors such as mosquitoes and ticks. The higher temperatures increases It alters precipitation patterns to create favorable conditions for the proliferation of these vectors. So with that,
Ashley, a
yes,
request from our interpreters. Could you slow down a little bit?
sure, I can,
Thank
definitely.
you. There is an audio channel in French for
Okay.
those who do not speak English and prefer French. So please, thank you.
Oh, no worries. Thank you for that. Just to continue then for the interpreters. So with vector-borne diseases, the higher temperatures increase. It alters precipitation patterns that can create favorable conditions for the proliferation of these varying vectors. So once temperatures increase, then transmission of such diseases like malaria, dengue, fever, and the Zika virus also increases. So then recently, we've seen that there have been wildfires in Canada that have been affecting air pollution, the air pollution for the citizens within New York. So air quality and respiratory issues is also one way as well in which climate and health are linked. So climate change contributes to very poor air quality, mainly through the emission of greenhouse gases and the formation of air pollutants. So increased air pollution, including particulate matter and ozone, really worsens the respiratory conditions of us as human beings and even our biodiversity, including animals, such as, but within humans, within itself, we see respiratory conditions such as asthma, allergies, and other chronic obstructive pulmonary diseases. But it goes a step further when we're actually looking at the short and long-term impacts of climate change. Waterborne diseases is another factor that we must consider. The changes in rainfall pattern, including increased flooding or prolonged droughts. And I'm sure we're seeing an increase in flooding across Asia, even here in Barbados and in Africa and different parts of the world, are prolonged droughts. This can have an impact on water quality and varying sanitation systems. So contaminated water sources, inadequate sanitation facilities, and compromised hygiene practices can then lead to the spread of waterborne diseases such as cholera and diarrheal illnesses. This is why, again, it is so important that we equip our healthcare facilities to become more resilient to the impact of the climate crisis. And I come from a small island developing state where overall, collectively as SIDS, we only contribute 1% to the total greenhouse gas emissions. But yet, every day we're seeing dramatic changes to our environment, which is making us more vulnerable to the impact of the climate crisis. And again, our young people are the ones who are being most affected by such. We then go into food security and malnutrition, which is another factor that we're seeing, whereas climate change affects agriculture productivity, leading to disruptions in food production, availability, and nutritional quality. And as extreme weather events continue, the changing in precipitation patterns and an increase in pest infestations can result in crop failure and food scarcity. And these factors contribute to malnutrition, both in terms of undernutrition and an increased risk of overweight and obesity due to changes in dietary patterns. And going back home to Barbados, here at home, 1 in every 3 children is either considered overweight or obese. So as climate—
Ashley, could you slow down for translation? Thank you.
Okay. So 1 in 3 children in Barbados is either overweight or obese. So as the climate crisis worsen, then we will continue to see an increase in the amount of children and young people at home here in Barbados that are living with a form of non-communicable diseases. So for those who aren't aware, non-communicable diseases are chronic diseases such as asthma, cancer, cardiovascular diseases, and diabetes, and so much more. And to further extend my point, when it comes to mental health as well, climate change related events such as natural disasters, when we all go through a natural disaster or some form of climate related event, some persons' homes are lost as a result. Some persons' livelihoods are completely destroyed, and the uncertainty of the future can have, and we have begun to see that it has psychological impacts. And these include the rates of anxiety, depression, and post-traumatic stress disorder, and other mental health conditions. So with that being said, now I'll go into the Hey campaign. And fortunately enough, I was able to recognize the short and long-term impacts of climate change. And this led me through the Ashley Lashley Foundation to establish the Healthy and Environmentally Friendly Youth Campaign, which is called Hey. So instead of saying Healthy and Environmentally Friendly Youth, we just go by Hey. And this is a global call for youth-led advocacy and activism on the many persistent and emergent issues in which I mentioned before, stemming from climate change. And Hey really highlights and bring awareness to more than 100 young advocates across the world on climate change and the relationship it has with human health, not only the physical health, but also the mental health. And some of our key activities include, as you guys can see, the Hey capacity building. We have the Hey Global Youth Network Summit. We also recently started the Hey Research and Data Hub. And then we also have the Hey Climate Fund. In the essence of time, I won't really speak on all of the activities, but the Hey campaign continues to bridge youth from all spheres of Earth to advance our understanding of the impacts and threats that are posed by climate change and also compound our resources. But really and truly, the essence of the Hey campaign is to amplify the voices of our young people and their actions, and therefore intensify our impacts. So through Hey, I would have just mentioned this, our motto is to let's throw hands together for a healthier future. And the campaign is entirely youth-led and is linked to the Sustainable Development Goals number 3, number 10, and number 13 of good health and well-being, reduce inequalities, and climate action. And here you can see that we're globally represented in 6 different regions of Asia, Africa, North America, Latin America, Europe, and the Caribbean, with all young people taking action for climate and health. So I would encourage you to also take the same. So again, through the Hey campaign, we build the capacity of our children and young people. The youngest Hey ambassador that we have to date is actually 9 years old. So our children are very young, are really understanding that we as young people have a role to play in taking action for our environment. So we have multiple training sessions happening throughout this program that highlights climate change and health. We even go climate change and gender, air pollution. We also take our young ambassadors into training on data and research collection. We look at the policy implementation, and there's so much more topics in which we cover under our capacity building training sessions under Hey campaign. And this one is one of my favorite programs under the Hey campaign. It was only started last year, but the reason why it was implemented was because I realized that there was limited access to financial support for us as young people when it comes to our projects. So through the Hey campaign, we are looking at reimagining and redefining climate finance in an intergenerational context. And we are supported financially and technically three high impact projects in the areas of climate and health. Last year, we gave a grant on climate and health to a young person within the Philippines. Climate and gender was a young person from Guatemala, and climate entrepreneurship was a young person from Barbados. But I'm happy to say that this year we will be awarding 3 projects total on climate and gender, again, climate and health, climate advocacy, climate entrepreneurship, green technology, and water and climate security. So I know even throughout the last 3 days with your participation in the workshop, you probably have some ideas on some projects in which you want support for. So I'm encouraging you to look out for the launch of the Hey Climate Fund before the ending of July. And I would invite you all to apply. And again, you can stay posted to our social media accounts at We Are Hey on Instagram or the Hey Campaign. So to go a bit further, as I mentioned, the Hey Campaign looked at, actually we conducted some research last year on climate change and its impact on women and children's mental health. And there was a preliminary study that sought to identify and model variables that contribute to the impact on women and children's mental health. And as you can see on screen, our study consisted of over 95 persons across 10 small island developing states. 97% of persons do perceive climate change to be real, with many expressing negative impacts from climate change. Over 50% of individuals between the ages of just 13 to 17 noted that they have experienced some form of anxiety, depression, grief, and learning loss as a result of climate change. And 20% of women who participated noted that they have had experience with anxiety, depression, and post-traumatic stress as a result of climate change. So after carrying out this survey, we noticed that several critical and crucial issues were observed during this study. And 2 of the primary issues were that 1, persons, especially our young people, are still not comfortable speaking about mental health matters. And as a result, for us as stakeholders, it becomes difficult for us to fully gauge the impact of climate change and its impact. And 2, there's far greater need for more post-climatic event initiatives, as respondents have stated they suffer from mental health issues post such climatic events. So these preliminary results will continue to help us to develop a deeper understanding and research into the area of climate change and mental health for greater policy recommendations. So as we said, that we all have a role to play in taking action for our environment. And at this time, I'd like to invite one of our youth activists, Naomi Cambridge, to just give a short, brief testimonial of her experience under the Hey campaign. So I guess I'll stop sharing my screen so Naomi, they will be able to see you.
Okay, thanks, Ashley. But yes, as Ashley said, my name is Naomi Cambridge. My journey with the Hey campaign began last year, early last year, around this time, actually. I was actually encouraged to join it by Ashley, and it has been a really, really great experience because with all of the different activities that the Hey campaign brings, for example, the training sessions were what I was first exposed to, and those training sessions are basically where the youth activists that are included in the Hey campaign are able to have interactive training sessions with experts in the field and in various different areas and in various different topic sessions that Ashley would have talked about. And when I went through those training sessions, not only did it educate me further on something that I was already really passionate about, but it also gave me an opportunity to know more and develop more my activism power and the impact that I could have as a youth advocate for climate activism. And then beyond that, when the training sessions were over and also throughout the training sessions, one of the really great things about the Hey campaign is how vastly impactful it is. So we have so many different regions that are represented in the Hey campaign, like Ashley's spoken about, the Caribbean not only, but also North America, Latin America, Asia, Africa, and we're able to interact with so many different youth activists from those areas. And I was able to have so many connections with people that have the same interests as me, but I would have never been able to connect to without this campaign. And we were able to collaborate on different projects, on different initiatives. And then also moving off of that, the opportunities that the Hey campaign gives you can be really empowering as well, because the problem that we face as youth activists or people, young people that are passionate about climate activism and health and how it relates to climate change, is that a lot of the times we're not given a space to actually express that in a place where the people who can actually make the monumental change, like policymakers and whatnot, are not able to hear us, or we're not given the space to be heard. And with the Hey campaign, we're given a platform where we can actually express our thoughts, express our perspectives, and express our voices for change in the different panel discussions, the training sessions to increase our capability, and then also the different connections that we would make, not only with other activists in the region, but also those same policymakers and those same change makers that you would want to get that access to. And then another thing is that when I moved up this year to becoming the regional focal point for the Caribbean, which essentially means that I manage all of the other youth Caribbean activists that would be coming into the Hey campaign this year, specifically for the Caribbean region. I oversee them. I'm able to do what the Hey campaign did for me last year, which is inspire them to take on those projects that they are so interested in taking on, and nurture them and help them grow as activists, help them grow as potential change makers, and help them see their true potential as youth, because a lot of the time we as youth are seen as just individuals that are supposed to be on the sidelines, and we essentially suffer in silence because we are not able to be given that space to express our unique perspectives and our very important perspectives, because we are on the front lines of this climate crisis, and we need to be heard because we are the ones that are feeling the most impact, especially us here in the Caribbean, because even though we, like Ashley said, contribute less than 1% to global emissions, we suffer the most. So all of these things are really important. So that's why it's so important for me to be given the opportunity to help other people like me, be given that platform to grow and to share their impact and to help them develop these innovative projects that can be really, really influential in the long run. So in the interest of time, even though I'd love to speak more about it, I'm going to just wrap up. But essentially, the Hey campaign has been really influential in my activism journey, and I would recommend it to all youth because it really is a very great initiative. Thank you.
Thank you, Naomi. Back to you, Ashley, and you have just one more minute, and then we have a little time for quite a few comments. Thank you.
Okay, great. Thanks. Well, actually, Naomi was the last part of my presentation today. So thank you, Naomi, for sharing that testimonial. And I think we can open up for question and answer if it's okay with you both. You're muted.
Thank you for thank you so much for your excellent and inspiring and thought-provoking presentation. It sounds, you know, a lot like a wake-up call But you all have woken up, you literally woke up, or I'm not sure if you went to bed before the presentation, because you told us you were up at 3 a.m. We really appreciate that and take the opportunity to inform us about the Hey campaign and the work that your foundation is doing. Thank you so much. And of course, the most obvious question, because we are here with people who are active on a local level, either as practitioners, scientists, practitioners and policymakers from really all over the world. And it would be very useful to know for them if in their country is an ambassador for the Hey campaign, and if not, so we will surely share the contact details of your foundation with everyone here. What do you think about that?
That sounds great. And I'm sure that their ambassadors, even if they're not present in your country, but within your respective regions, I know we have a big cohort of youth ambassadors from Africa, Asia, and the Caribbean are our current biggest cohorts. We still have youth representation in North America, Europe, and Latin America as well. So you guys can feel free, if you're interested, to send us an email at info@Ashley Foundation.org,
We will share.
To reach out to us on Instagram at We Are Hey, and one of our colleagues would respond.
And you find the email address in the chat, and we will, maybe Naomi, you can share some other relevant resources in the chat.
Yeah, sure, no problem.
And then we also have a question from the audience, which is congratulations on this passion, hard work, and advocacy. How do you consider community health professionals can help empower young leaders?
Well, firstly, I think community health professionals, there needs to be an increase in the training capacity of community health practitioners. I find that when it comes to like the term practitioners, normally the information that is relayed to us as young persons are often hard to understand. So one of my key tips when I'm speaking to like community health practitioners or practitioners is to ensure that the message in which you're delivering to young people is as relevant, one, but as is communicated in a way in which we as young people understand, but also getting involved in the varying youth projects that probably is happening at a community level on ground, and finding different ways within your overall network to train and build the capacity as well of young persons within your varying community, and give them an opportunity to shadow or you mentor them in some form or fashion in community health activism that they're passionate about. So that would be my kind of suggestions and recommendations.
That's really great. And finally, one of our participants asked if you have any projects in Africa. We have a lot of participants from Africa, from Francophone, but also English-speaking Africa. Are there any? Where can they find that information?
Naomi, you can go, says your hand is raised.
Naomi? Just briefly, and then we'll close the session. Yes, Naomi, can you?
No problem. I just wanted to shed some quick light on one of the projects that one of our African regional focal points is actually doing. His name is Aliyu Sadiq.
Will be in the chat.
Yes, I'll put his information in the chat as well. But essentially for World Environment Day, which was just a couple days ago, he is doing a Beating Plastic Pollution and Eco-Friendly Youth Drive, where essentially he did a climate action youth tour in commemoration of World Environment Day. And essentially what they did is he collected a lot of the youth in his community, and they gathered together lots of plastic waste, and they banded together to make a lot of eco-friendly products. And one of the things that they did is make a eco-friendly toilet in their community, in one of the disadvantaged communities that they have. And it's really, really interesting and very cool. And one of the ways that I'll share the information with you is he posted a lot about it on his Instagram. But I don't have the time to talk about all of the African
I'm sorry.
projects that we have.
So there are many more. We will
Yeah.
share the information, what we have. And
Yes.
thank you, Naomi, for your testimony and your contribution. And Leslie, maybe one closing word for you before we move to the next presentation.
Thank you, Goff. I just want to say, well, thank you for inviting the foundation and myself to participate in the community workshop. And what I would say, though, as a closing remark is that in order for us to achieve climate and health justice, we all must trail hands together for a healthier and more sustainably friendly future. So I would just encourage everyone to, not work in silos, but I guess this is what this community workshop is also for. So let us continue to band together to really advocate for the necessary health justice and climate justice that we all require for a more sustainable and healthy world. Thank you, everyone.